Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, as well as Mickey Frost, the City of Mississauga's Director of Works and Operations Maintenance, to answer any questions on the city's response to Monday's snowstorm. I first want to talk about a young man in Mississauga who showed us over the weekend what a true hero looks like. On Saturday, a house fire erupted near Winston Churchill and Britannia with 3 children stuck on the second floor. 2 of them had managed to get out onto the roof, but one, a 7-year-old, was still stuck inside the house. And that's when a neighbor from down the street, an 18-year-old young man named Adam Attila, sprung into action. Before fire crews arrived, Adam got himself onto the roof of the neighboring house and jumped down to the second floor roof of the blazing home and brought all 3 children down to safety. I know Mississauga's Fire Chief Darren Rizzi will be honoring Adam with a Fire Chief Citation Award, and I will also be presenting him with a mayoral certificate when I meet him in person. Adam, you are a true inspiration and a true hero. I also want to thank our amazing team at Mississauga's Fire and Emergency Services for their quick action in battling what ended up being a very intense fire. I also want to give a shout out and a big thanks to our city crews for the incredible work they did to help Mississauga get moving again after we were walloped with 45 centimeters of snow on Monday. It was the most snow our city has seen in a single day since 1944. Our crews have literally been working nonstop over the last few days, and I'm happy to report that all major roads and sidewalks and the vast majority of bus stops and residential streets have now been cleared. This was truly an all-hands-on-deck effort. On Monday, close to 500 plows and salters were in action clearing snow. And because of the quick response of our crews, none of our major roads were closed, and there were no reports of serious accidents. We did see delays on a number of my-way routes, with several buses stuck in the snow. I want to thank all Mississaugans for their patience as we worked hard to dig ourselves out of a near-record snowfall. I want to thank everyone who supported their neighbors in any way they could. And I want to thank our frontline workers at My Way, Mississauga Fire, Peel Paramedics, and of course Peel Regional Police for helping keeping our residents safe. A big reason why we were able to respond to the storm so effectively is because staffing levels across the city of Mississauga have remained stable and manageable despite the transmissibility of Omicron. Less than 5% of city staff are off right now due to COVID-related illness or isolation. Mississauga Fire, Peel Regional Police, and Peel Paramedics also continue to maintain their service levels. And while we have temporarily suspended some transit routes, My Way is still operating at 88% capacity. We're still seeing very high transmission of COVID-19 in Mississauga and across the province. However, there appears to be hope on the horizon. Ontario's Chief Medical Officer of Health, Dr. Moore, said earlier in the week that the number of admissions to ICUs across the province is slowing down. Locally, Trillium Health Partners is still grappling with several hundred patients with COVID, but the good news is that staffing levels are improving, with a substantial decrease in the number of staff off due to illness or isolation. I'm very hopeful these trends will continue over the coming weeks. Experiences in other jurisdictions like South Africa and the UK have shown that Omicron hits fast and hard and then thankfully subsides. I'm hopeful this will be our experience and our story here as well. I want to thank all Mississaugans for continuing to play their part by getting vaccinated and by following the public health measures in place during this surge. I know people are still quite nervous and frankly anxious about the situation we're in with the spread and hospitalizations still high. And I fully understand and share those concerns. We are in the thick of the flash flood right now, but if our experience is similar to others, the forecast is calling for brighter days ahead, which is why I think it's important that we start looking to the future. We know Omicron presents a very different risk for those who are protected with vaccination. That means with a highly vaccinated population that typically experiences milder symptoms, our focus should now shift towards preventing serious outcomes rather than infections alone. This means that as our trends start to stabilize, it's time to look at loosening restrictions and helping get our businesses reopened, which is why I'm encouraging the Ontario government to gradually ease restrictions by lifting lockdowns and allow indoor dining, gyms, and theaters to reopen with capacity limits and proof of vaccination requirements in place. I'm also encouraging the government to slowly increase capacity limits that have been in place on other businesses, such as personal care providers and retailers. I understand a formal announcement from Premier Ford is coming this morning that will see indoor dining resume with plans to ease restrictions on other sectors in the weeks and months to come. Of course, any changes of this nature will need to be closely monitored to ensure the situation in our hospitals remains stable. I look forward to learning more from the Premier this morning. Now, I know some people may ask why I'm joining the discussion around easing restrictions while our hospitals are still under a lot of pressure, and that's a valid question. I want to be clear. I've always supported public health measures that protect our hospitals and our healthcare system, and I will continue to do so. However, by spreading so quickly and so widely, we know that Omicron has changed the game. And that's why the public health approach to the response to Omicron has shifted. Again, we know that those who are vaccinated experience less severe symptoms, which is why we are in a much different place today in terms of managing risk than in previous waves. That means with Omicron circulating so broadly in our community, our focus needs to be to turn to protect those most vulnerable, the elderly, the immunocompromised, and pregnant individuals, and those more susceptible to hospitalizations, and moving away from lockdowns. When indoor dining, gyms, and other businesses reopen, the best thing that we can do to ensure they all stay open is to get vaccinated. As we transition, it will be vital to maintain the other measures we have in place, such as masking, as much as possible, and proof of vaccinations to protect those at highest risk in our community. I cannot stress this last point enough. Any loosening of restrictions must continue to be met with strict health and safety measures. Before I bring up Dr. Lowe, I do want to reiterate to residents that the single most important thing that you can do to protect yourself is to get vaccinated and boosted. I'm so proud that close to 90% of our residents 12+ in Peel Region are now double vaccinated. And over the weekend, we saw a solid turnout at our back-to-school pop-up for 5 to 11-year-olds at the Save Max Centre. With kids now back in school, I encourage parents to please take their children to get their first or second dose if they're eligible. And education staff, please make use of those priority bookings for booster shots at the International Centre by calling 1-833-943-3900 or at our other designated location at 6585 Airport Road by visiting fh.vax.com. Every day we have more booster shots coming online for all those eligible, so please don't wait to get boosted. Yesterday, we opened up a new fixed clinic at Rockwood Mall at 4141 Dixie Road, in addition to the 2 other at the Region of Peel offices on Huron, Ontario, and at the Sheridan Centre. Clinic operations will begin with targeted appointments for priority groups and will phase up to full capacity shortly. Dr. Lowe will share more information and more details. Please visit the Region of Peel's website for all the clinic hours, including our numerous pop-up and school clinics. Mississauga, I'm so certain that brighter days are ahead. In the meantime, though, please remain vigilant, follow public health advice, and get your first, second, or booster shot if you're eligible. I will now invite Dr. Lowe up to speak.
Thank you, Madam Mayor, and good morning. There are trends this week that are suggestive that Omicron transmission is starting to plateau in the Region of Peel. But I want to be clear that it is plateauing at a high level of transmission in our community. During this period of widespread transmission, the best protection still remains to get vaccinated. 2 doses are helpful, and a booster is even better, especially if you're over the age of 50. We continue to accept walk-ins for any resident over the age of 5 that needs their first 2 doses, including our elementary-aged school children between 5 to 11 years of age. To my fellow parents with eligible children in this age group, please know that the vaccine is safe and effective. It will protect your little ones and give you peace of mind. And as I've shared before, I ensured that I got my own eligible children in this age group vaccinated as soon as they became eligible for the vaccine. On boosters, we are continuing to free up capacity and appointments for boosters every day. And as Madam Mayor mentioned, we have opened now the Rockwood Vaccine Clinic in South Mississauga, which is adding 5,000 weekly appointments to our overall system. As our newest clinic, over today, tomorrow, and Saturday from 4 p.m. onwards, we are offering walk-ins for boosters 18+ at our Rockwood location, with Pfizer available for those who want that choice. You can also visit peelregion.ca/COVID-19 vaccine for information on all of our vaccine clinic offerings. As it concerns other precautions, I want to remind our residents that the provincial approach has changed in the face of the more transmissible Omicron variant. Our focus is now less on preventing infections alone to preventing severe outcomes, such as hospitalizations and ICU stays, which is also why vaccination remains crucial. That said, I want to be clear on some of the other key changes in our response. Firstly, around testing. Unless you work in high-risk settings such as hospital or long-term care or meet any of the other criteria specified in the provincial testing criteria, you do not need a test to confirm a diagnosis of COVID-19. If you or anyone else is sick, stay home. Review your symptoms against the provincial screening tool, and please follow the directions on how long and who should self-isolate. Once your self-isolation period has passed and provided your symptoms are resolving, you do not need a negative test to confirm the end of your isolation. In saying so, I understand that certain employers in our community are requiring proof of negative tests following illness in order for employees to return to work. This practice should stop immediately. To be clear, if your symptoms have resolved and your isolation period is over, no test is needed to return to work. I urge employers to revise their testing policies to eliminate a focus on negative tests for return to work. If anything, you should be looking at vaccination policies rather than exclusions on the basis of test results. Residents who have recovered and are seeking tests for the purposes of returning to work settings other than those that work in our highest risk settings as defined by the provincial criteria will be turned away. If you are turned away from a testing centre because you do not meet the criteria, I ask that you do not abuse or harass the testing teams who are enforcing the criteria at these centres. I have been very disturbed by reports of physical abuse of staff at assessment centres being run by our provincial and community partners who deliver testing, along with similar reports of abuse and frustration at our vaccination clinics. Let me be clear, anger and frustration is never an excuse for assault. You will be asked to leave if your behavior is out of line. Please be kind and show respect to our staff who are working hard to protect you and our community. Secondly, I want to address changes to tracing. Employers should be aware that in line with Ministry of Health direction, outbreak investigations and contact tracings are also now being prioritized for the highest risk settings, again, in a bid to reduce severity and protect those that are at the greatest risk. A few weeks ago, Peel Public Health rescinded our Section 22 for employers and workplaces in line with this new provincial direction. Therefore, it is no longer necessary for workplaces to report cases to public health unless specified by the current ministry protocol. Managing COVID-19 in workplaces for the vast majority of workplaces has now reverted to being an employer responsibility under occupational and health and safety regulations and Ministry of Labour direction. I encourage all employers in the region of Peel to review guidance for your workplace sector available at the Ministry of Labour's website and ensure that you fulfill your obligations to ensure employee safety. As Mayor Crombie spoke, we are in the midst of a time of transition. And during this time of transition, our testing and tracing efforts are now focused on protecting our most vulnerable and preventing severity in our community. For all our residents, however, getting vaccinated, staying home if sick, wearing a mask, and keeping gatherings and contacts small while this surge resolves are the measures that will continue to see us through. Thank you for your attention today, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And before I take questions from the media, I just want to quickly say a few words about the housing summit that took place yesterday with Premier Ford and Minister of Municipal Affairs and Housing Steve Clark and Ontario's big city mayors. It was great to finally sit down with provincial leaders to speak openly and frankly about what needs to be done to address the housing affordability crisis. We were all in agreement that no one level of government can tackle this problem alone. We had some very productive conversations about the need to expedite more affordable housing. And I want to thank the province for announcing a new $45 million investment to create the Streamlined Development Approval Fund to help accelerate housing applications. This is, of course, just one piece of the puzzle, and we know that the real progress will require all levels of government, industry, and investors to work together. I'm very pleased that the province has committed to continuing this conversation with Ontario's big city mayors. And now, along with Dr. Lowe and Mickey Frost, and Scott Holmes is here too, we're happy to take your questions.
Mayor Crombie, your first question today comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Morning, Mayor Crombie. How are you?
I'm very well, Steve. How are you feeling? You're over your COVID, I hope?
Just some congestion. As you mentioned, it does stick around for a little while, but for the most part, I'm doing good. Thank you.
Good.
Yesterday, City Council voted to halt consideration of renaming Dundas Street. And as you mentioned, you're at the province's housing summit kind of at the time of the vote.
Yeah.
So earlier this month, the council did vote, however, to review policies on city streets and other assets. And city staff said the city would be in better position to make a determination on Dundas Street kind of after the review, which will look at naming through diversity and equity and inclusionary lens. But wondering if you would have voted to stop looking at renaming Dundas yesterday if you were there, and what are your thoughts on whether it was a good move to kind of shut down consideration of renaming Dundas before that review was complete?
You're putting me on the spot, are you? The vote at council was unanimous. I mean, I would have clearly preferred if council had voted that we continue the review and look at all aspects of our renamings, whether there are city streets or they are our assets or other naming assets. However, they have been receiving a lot of information from outside sources, academic sources, and a lot of interest from our residents on how we will approach this, and certainly many groups have emailed their councillors and spoken quite loudly that they didn't feel it was the time or the need to consider Dundas Street in our renaming process. So I think Councillor Parrish wanted to end the speculation on which direction the renaming may go, and of course had the support of the rest of the council members. I know that Councillor Sato had wanted to delay it or defer it a little bit to give other groups an opportunity to make some more comments. And, you know, clearly I would have preferred that we'd gone through the full process, but it was a unanimous decision. And, you know, we are a very high-functioning council that we work together and we're very collaborative. So if that was the you know, we tend not to vote in different directions. We tend to vote as a group. So I likely would have supported Councillor Parrish because our council wanted to move ahead to put that issue to rest, but yet create a policy, as you suggested, with an EDI lens that we are going to apply to all future street renamings. And of course, there is a need for new namings as well, because we have new developments in place down at Lakeview, at Brightwater, in the downtown core, in the uptown core, in the 9th Line core. So we need a renewed, a revised street naming policy, as well as a policy that applies that EDI lens to our other assets. Thank you for the question. Is there a follow-up?
Yes, I was just hoping to ask
Dr. Lowe?
perhaps yourself and Dr. Lowe just about if the reports are accurate that we're looking at a partial reopening on January 31st. If just maybe for both your opinion, both your thoughts on this, is it safe to do so based on what we're seeing in hospitals and I guess what we know about cases with Omicron? You
know, it's a very valid question and a valid concern as well, but I'm very hopeful. The trends are certainly very positive, that we're seeing declining numbers of staff who are out with COVID or home from isolation. We see hospitalization numbers declining, ICU numbers declining. So the trends are there. We know that the science table has done the modeling, and it looks like we are peaking now and things will start to turn around. And we also have the experience of other jurisdictions that have gone through Omicron. So we know the experience in the UK and in South Africa and Israel, etc. So we know that this is the peak of that flash flood and things are now stabilizing. And, you know, we don't want to keep businesses closed longer than necessary. Our businesses have already suffered the longest lockdowns in North America, quite frankly. So the goal was always to reopen them as soon as it was safe from a public health standpoint. And I believe that Dr. Lowe, myself, and the science table believe that now is the appropriate time. So Dr. Lowe, why don't I ask you to comment on this as well?
Yeah, thanks, Madam Mayor, and thanks, Steve, for the question. As I mentioned in my remarks, you know, the widespread nature of Omicron transmission that has occurred, coupled with our high vaccination rates and the less severe course that vaccinated individuals are experiencing, has really shifted our context and our approach to focus more on preventing severity rather than infection in and of itself. I think there's a recognition, especially that hospitalizations and intensive care stays are a lagging indicator, and we certainly know that what we saw with some changes in our wastewater, last week we started seeing a slowing of growth. This week we're starting to see a plateau in our wastewater surveillance. We're starting to see test positivity resolving as well, and then of course the hospitalizations, intensive care. Make no mistake, there is certainly a press in terms of patient demand, and of course addressing the staffing absentee issues, which, as Madam Mayor identified, are improving, but also are a direct result of the isolation policies that are put in place to protect the most vulnerable in our community, particularly those that remain unvaccinated. So I think I've certainly been very clear throughout that we're shifting our approach in this time of transition, and it is really vital for our residents to make sure that they are vaccinated, that during the surge they are taking all the measures seriously around masking, staying home if sick, etc. And that remains our initial focus, of course, right now at an individual level, regardless of what might reopen. That said, with any reopening, we're obviously hopeful that we'll continue to monitor these trends closely. We've just had schools go back, and we're hopeful, as has been indicated by Dr. Moore, that reopenings will be gradual and careful, while also accounting for the shift in context and approach. Thanks so much for the question.
Just let me add a comment to Steve that, with our vaccination rates as high as 90%, I think the right factors are in place right now. Our job is to get everyone boosted, get those booster numbers up, and get our children 5 to 11 years old vaccinated as well. And I was just having another thought on the EDI discussion on the street renamings. I would have preferred clearly that we had done the review as we had laid out the plan. I was very supportive of the staff plan. But council has decided to put that one to bed, and so we'll move forward with a greater analysis of the remaining streets and the remaining policy. Thank you for the questions, Steve.
Your next question comes from Natasha O'Neill at the Pointer. Go ahead, Natasha.
Good morning.
Good morning, Natasha.
I have 2 questions for Dr. Lowe again.
Okay, here we go. He's coming up.
Good morning, Dr. Lowe.
Morning, Natasha.
I'm just kind of wondering if we can compare kind of last year's different waves and months to this year's. I know last year we saw a gradual decrease in cases by the end of January, February, but then it spiked again in spring. Is this a possibility for this year as well?
Anything's a possibility, Natasha, and that's why it's really critical for us to proceed carefully while also monitoring and recognizing that the context has shifted. But specific to the example that you're using, we know that the spike in spring was due to the emergence of the Alpha variant. At this point in time, Omicron is so widespread and so transmissible, it would be, my professional opinion that any additional variant that comes out would need to be extremely transmissible, like way more transmissible than Omicron, to be able to outcompete it. So at this point, it's really a matter of this is the variant we're dealing with, which is Omicron. We're also dealing with not a largely susceptible population like we were dealing with last winter and spring, but a population that now is highly vaccinated with a lot of 3 doses as well in our community. Over 70% of our 70 plus now vaccinated with 3 doses, for example. So, I think the context is different. The variant is different. Obviously, we do proceed forward with caution, but we do need to proceed forward, in some measure, just recognizing the shift in our approach and context. And your follow-up?
Yeah, we're talking a lot about how cases are kind of plateauing and we're moving towards possibilities of good things happening. And I'm just kind of wondering, what are some key indicators that you from a public health standpoint need to look at so that we can know that we're moving towards this endemic phase?
It's a great question. So we're looking at all the things that I've mentioned. As I mentioned, the trends that we've noted, at least a plateau or resolution, and include our wastewater surveillance, which is being done at both our G. Booth and Clarkson wastewater plants here in the region of Peel. We're also watching test positivity very closely. Of course, hospitalization, but even within hospitalization, we're looking at things along the lines of length of stay. We're looking at the nature of hospitalizations. We're looking at intensive care, nature of presentations that are being reported. And of course, vaccination rates, because those are absolutely essential just to make sure that we have that wall of protection. It is worth noting in terms of all those measures, and the reason why all those measures are taken together is that this is now about the things that people can do to protect themselves in the midst of extremely widespread transmission that's beyond, or that is really, beyond broader control, if you will, through testing and tracing, as it were, in the traditional form. So everyone should be checking their vaccine status, making sure they have at least 2, preferably 3. Everyone should be making sure they're masking when they're indoors. These are the things that we've all known for the last little while to ensure our levels of protection, and that's why we're measuring all of those different indicators. And lastly, I'll mention in terms of things that we're also measuring, the Ontario Science Table data is very clear that people who remain unvaccinated at this point in the pandemic, in the midst of this surge, because even if we're getting to a peak, we're still at a very high level of transmission in the community. People who are unvaccinated are 6 times more likely to be hospitalized and 10 times more likely to end up in ICU. So please, with our hospitals overflowing, you don't want to become a part of the wave, and you certainly don't want to become a statistic. Get vaccinated. Thanks for the question.
Next question, please.
Your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
Welcome, Declan.
Good morning, Mayor Crombie. How are you?
I'm feeling very well. How about you?
I'm well, thank you. Just a first question is concerning the snowstorm on Monday, and a lot of residents were stranded in their homes and so forth. Will staff be doing a post-mortem on the response to the storm, especially where back-to-back weather events hitting Mississauga are concerned has happened this week?
Yep. So I'm going to bring them up in 1 second. Let me just say that I'm very proud of our staff and very grateful to them. They worked countless hours. I think they worked 37 hours straight to clear the snow off our streets. And they had all our priority routes, our bus stops and our sidewalks done within the first day, and then started working on the secondary routes the next day. Were there some gaps? Well, of course there always are. They can't be in all places. But I'm very proud of the work that they did, and they worked so very hard. And in fact, our My Way service as well, while we were experiencing delays, so was everyone across the city. So we were experiencing only mild delays. So why don't I bring up, I think, Mickey Frost here. He's going to speak to you on the outstanding work that Scott Holm and his teams have done to remove what was a one-day record snowfall since 1944 with 45 centimeters of snow. Over to you.
Thank you, Madam Mayor, and thank you for that question, Declan. As Madam Mayor mentioned, this was an unprecedented snowstorm with almost record-setting snow levels, with approximately 45 centimeters falling within 12 hours. And clearing this volume of snow takes time and resources, and we have been working around the clock since Sunday with over 500 pieces of snow clearing equipment to remove all that snow. And typically after any winter event, we do a deep dive to see what we can do better and where we can improve. And certainly after this winter event, we will be doing the same.
Thank you, Mickey. So there you go. You have your answer that there will be a postmortem. Next question or follow-up, please.
Yeah, a question for Dr. Lowe, please.
Yep, no problem. Here he comes.
Go ahead, Declan.
Good morning, Dr. Lowe. I know last week the vaccination rate among 5 to 11-year-olds in Mississauga and Peel was hovering around 40%. Is that, I know there have been efforts now to increase that. Is that number increasing, and what would that percentage be at this point?
Yeah, thanks so much for the question, Declan. 42%, in fact. And if you're comparing us to other health units, we've actually delivered as many doses as Ottawa and York, but they obviously have less 5 to 11s. And so what's happening is we've delivered roughly 55, 60,000. York has delivered roughly around the same, but theirs translates to 55, 57% because they have less 5 to 11s. But what is really positive about our 5 to 11s, and I'm really grateful for the community for stepping up, is that we're continuing to see steady numbers. I think many other areas have hit a plateau in their 5 to 11 vaccinations. We're still seeing hundreds of kids coming forward every day, and really grateful as a parent with children in this eligible age group to see those kids getting protected against severe outcomes like inflammatory syndromes, against hospitalizations and unneeded hospital stays. I remember once taking one of my children to the hospital for croup, and I know just how much anguish a parent can feel with just a child that's struggling to breathe, that has respiration. So I mean, I really encourage people just get the certainty, get that protection for your children, and take a lot of the risk out of the equation, especially with Omicron surging. But really grateful, of course, for the work of our community partners, all of our staff at the vaccination clinics who continue to work diligently to get this age group vaccinated. We've got a bigger mountain to climb than many other places, but we will make sure that as many 5 to 11s are protected with vaccine as possible. Thanks for the question.
Declan, it's the beauty of Mississauga. We have all young families with lots of young children. We love it.
Your last question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Welcome, Khaled.
Let's touch a little bit on the housing summit with
Sure.
Ford yesterday.
Yep.
And did you come up with any specific recommendations? And if you can also expand a little bit on the $45 million
Yes.
the approval fund, what is it exactly for, and how it will be used, and what is it in for Mississaugans?
Okay, so it's very good questions. I'll start with the $45 million fund, which is an investment to create a new streamlined development approval fund to help accelerate housing applications. So we don't have all the details yet, Khaled, but I'm assuming that it may help those municipalities who don't have the IT capacity to build their own e-plans the way Mississauga have already, to help us all improving our processing. So maybe that may mean more planners in our departments. Mississauga has been very successful with creation of a development liaison individual, and perhaps that money could be allocated to such an individual. So we don't have all the details yet, but certainly it will help us process development applications. I believe that will be the purpose of the fund. And yet we know that this is just one piece of the puzzle, but what is really important that we came together with the provincial government to talk about solutions. We need to bring the federal government into the mix as well, so that the three levels of government can collaborate and really find answers to create the housing supply crisis. And, you know, from Mississauga's point of view, we are doing things really well here. We have 20,000 units already approved, permits have been approved that haven't been pulled by the development community yet. We have another 40,000 that could be pulled at any time that are as of right. So we actually have about 60,000 units that could be built in Mississauga at any time. And I am also aware that we hit our targets 95% of the time. Those are our approval time targets. So I'm very proud of that. And in the years of COVID, 2020, 2021, we were issuing over $2 billion worth of permits. So I know we're doing things right here. We were one of the first to embrace e-plans, to do the electronic processing of applications. We've also embraced lean as a city, so we cut down on red tape here at our city. We're always looking for ways to do things better. And I'm very proud that we're all a poster child for e-plans and for lean here at our city. So we're doing a lot of things right, and the province called us out on that. They gave us a big shout out a couple of times to say Mississauga is doing things really well. But we need to come together and we need to learn from each other and implement those best practices right across the province. So, you know, not only that, but there's room to do better everywhere, at Mississauga included. We'll continue to learn from other jurisdictions on how we can reduce our processing times. There are other municipalities that can do things better. The province as well, you know, we have to get input on all applications from various different departments, such as the Ministry of Transportation, the Ministry of the Environment at the provincial level. They too can, you know, we can work with them to help reduce the time allocation to get the comments back. We can look at better use of surplus land so that we can build affordable housing that's fit for long-term care or for subsidized housing or for just build more affordability for the middle class. You know, Khaled, that we have a strategy here at Mississauga to build more housing for middle class income earners, and that's really our priority here, making room for the middle class. And so it was a very frank and open conversation, and a lot of the mayors had some great input to make, and a lot of comments on I mentioned surplus land, reforming the OLT, the Ontario Land Tribunal, and just other ways that we can improve the process so that we can get more supply to the market. But how do we make it more affordable? Because we know that the cost doesn't impact the final price. The market demand sets the price. So we've done what we can to make it as cost effective as possible for developers to build, but the land price is the land price. So, you know, how do we make the land price, reduce the price of the land so that we can get more product to market, especially at rates that are affordable for young families. And those young families we were just speaking about, that we have many young families with many more children as a percentage of our population than in other jurisdictions. So I hope that's helpful. I mean, it was a very good conversation. The good news is it will continue, and we've opened that door now, and we will be speaking with the federal government. It would be wonderful that all three levels of government to sit together, to come together, to look for solutions to get more housing supply to the market as soon as possible. Oh, one of the other ones is a vacant home tax. You know, we looked at many solutions. But anyways, there was lots of work to be done, but we all have the same goal in mind. So it was a very productive meeting.
Thank you. Great. Before I ask Dr. Low, I have just a small question for you as well.
Sure.
After this historic windstorm, there was the worst windrows ever in front of the houses.
Okay, windrows.
And yes, and the other thing is in front of the bus shelters.
Oh, I know.
I know that
yes, we've heard,
residents can deal with that. But
sounds like you're getting
with the
3
shelters.
questions today, Khaled. Okay.
Yes.
So windrows, I
Sorry.
know. I do it myself. We shovel our driveways, and then the snowplows come down our street, and then they leave us a little gift at the end of the driveway called the windrow. So, Mickey, come on back up here. We have looked at equipment that would remove the windrow. It's very costly, and frankly, it won't service all of our streets. It will service the wider boulevards, the priority routes, but not the secondary streets. So, unfortunately, the windrow is one of the side effects of having your streets plowed. And I'm going to invite Mickey up to speak about our plan to eliminate windrows, and then you'll have a quick one with Dr. Lowe, and then we'll call it a day. Mickey, over to you. Thank you.
Thank you, Madam Mayor, and thank you for that question. So with this particular snow event, there was a significant amount of snow, and we do our best when we're plowing our streets to minimize windrows. However, with this much snow, it is really difficult. And as Madam Mayor mentioned, as part of our business planning and budget process, consideration was given to including windrows as one of our service levels, but windrows are not included because of the significant cost to clear windrows. But what our service levels do include is we clear priority roads, bus stops, and priority sidewalks. And once we've completed those, we turn our attention to residential roads. Thanks again for the question.
Thank you, Mickey. Dr. Lowe, you mentioned that it's preferable to have the booster for those especially over 50 and over. Why is this 50? How it was stipulated in the first place?
Thanks so much for the question, Khaled. And, I think I should probably make very clear that while we are shifting our focus towards severity, obviously we are also still trying to reduce infections to some degree as well. The point being, though, that because Omicron is so widespread in the community, the likelihood of people being exposed or in close contact or potentially being infected with Omicron is significant, which is why we need to keep up with the vaccinations, keep up with the masking, keep up with, making sure that we're staying home and if we're sick. And so it's for that reason that when we talk about boosters for folks under the age of 50 are really about trying to boost the active immunity to help reduce infection. And I think that's still an important piece of what we're trying to do, especially with widespread Omicron transmission. But we also know that the booster is extremely effective at boosting protection against severity for those who are over the age of 50. So if you're over the age of 50, more typically 60 and 70, that third dose is really essential to ensuring that we keep those folks healthy and well and out of hospital, because typically who we are seeing in hospital are individuals with no doses, as I mentioned, 6 times more likely on the wards or 10 times more likely in the ICU. And then also we are seeing some folks who are older, who maybe have had 1 or 2 doses, but because the immune system doesn't necessarily remain as robust in the long run, you do start to increase a bit of a risk in respect of both infection and severity. So boosters are important for everyone to help reduce the risk of infection in a period where we're all at very high risk of potential contact and infection, but particularly for reducing severity for those that are over the age of 50. I hope that helps to clarify. Thanks so much.
Okay, so Khaled, you managed to slip in 3 questions today. Are there any further questions?
That was your final question today.
Thank you all for joining us.